Hi, this is Ben. I'm a first-year occupational therapy student at Midwestern University. And in this video, I'm going to present to you my occupation-based kit on health and hygiene for postpartum mothers, which I put together for activity analysis class. So this kit can be used to help in recovery after delivery. It's especially useful for caregivers and mothers with limited mobility. And it also includes resources to help with postpartum depression. It assists in the activities of daily living of toileting and toilet hygiene and personal hygiene and grooming, the instrumental activities of daily living of care for others and child rearing, and the health management occupation of symptom and condition management. So let's look at what's in the kit. First off, we have coconut water, which is great to reduce leg swelling, which is very common after hospital discharge. The next set of items all relate to breastfeeding. So first up, we've got mother's milk tea, which is good for promoting milk production. Next, we've got breastfeeding bra, breast shell, and a Haka pump. Now, these are all very good for catching milk that's been expressed and just to ensure it doesn't go to waste and doesn't spill or stain clothes. We've also got some coconut oil for cracked and chafed nipples. And last but not least, in the breastfeeding section, a big old cup for water. It's got a wide base, just flat so it won't fall over. Hydration is a must for effective breastfeeding. Moving right along, we've got a multivitamin for postnatal women, postpartum women rather. And the last section is all about perianal and perineal care. So first up, there's this squeeze bottle. They'll give you a more compact one that's more effective for this task in the hospital, but the bottle is very, very useful when wiping with toilet paper is just too painful, and that'll potentially be for a couple weeks. The kit also includes these organic cotton pads. They're very absorbent. They are breathable and they do not stick on the affected area. You can use witch hazel to create something called a padsicle. And a padsicle is just basically when you add the witch hazel to the pad and you stick that in the freezer for a while. And it provides cooling to the affected area. Hemorrhoids are very common postpartum, so there are a couple things that I added to the kit to address that. Preparation H. Tucks are another similar product. They basically just provide cooling to the area. I also included some rectal suppositories. Now these suppositories actually decrease inflammation, and I included a glove to aid in placing them where they need to go. A couple more things in the perineal, perianal area. These are mesh panties. And they'll give you some in the hospital. Make sure you get a bunch. They fit basically every size. They've got this great elastic. You don't have to worry about staining them. You can just throw them out after you use them. And you can place the pad right down there. And these are great for the giant pads that they give you in the hospital, which are super absorbent. Finally, there's a set of high-riding cotton panties. These are breathable, and for women who have had C-sections, these are great because the elastic is higher up, which means that it won't interfere with healing of the C-section wound. Finally, this is a stool softener. The first stool after birth tends to be large and hard, and it can be very, very painful to pass it. So stool softener is a must. The last thing in the kit is a set of important phone numbers. It's important to know that you can reach out for help, but it's much better if you assemble these resources before the baby is born. So Central Arizona Breastfeeding Hotline and lactation consultant. These are places that you can reach out to in order to get help with breastfeeding. Breastfeeding is not intuitive. It's something that both the mother and the baby need to learn. Postpartum depression moms hotline. It's normal to feel out of sorts immediately after birth, but if you have persistent depression after birth, if you feel like you're not connecting to your child, if you feel like you want to hurt yourself or your child, definitely reach out as soon as you can. Finally, family and friends. It's important to be able to reach out to people who you know and you trust, who have been through the process of birth and raising an infant. They can kind of just talk you down off the ledge and provide tips that you hadn't thought of. And so now I'll talk about a couple of ways that you can grade up, grade down, and adapt these activities. So to grade up, you can make your own padsicles. So you just take an ordinary cotton pad and place the whole thing in the freezer and it's ready to go. To grade down, you'll potentially be taking a lot of different pills, so you can use a pill organizer. Another way that you can grade down is for someone who has issues with fine motor skills or grip strength, a non-slip pill bottle opener. Finally, to adapt some of these activities, if making your own padsicles is too much, you can buy pre-made padsicles and just use those. If the bottle is not working for you to stay clean after toileting, you can install a bidet in your bathroom. Just short circuit that whole issue. All right, so that is the occupation-based kit on health and hygiene for postpartum mothers. I hope it was helpful. Thank you for watching.